All right, let's begin. I understand that we have a record attendance on the webcast and the video conference capability today. So I hope everyone is still able to view the webcast. We've never experienced this number before, so there may be, as I understand, intermittent page errors. So I hope you can still stay with us throughout the duration of the seminar, and I apologize for these technical difficulties. I guess it's really due to the great interest in this talk today, which is good news. So let's start. Good day, and welcome to this Smarter Health Seminar. I'm Shirley Fenton, Managing Director of the Waterloo Institute for Health Informatics Research. Thank you for joining us for our seminar today. I'd like to welcome our web viewers and the Ontario Telehealth Network sites. This seminar is being recorded and is being broadcast over the web. We ask that you hold your questions to after the seminar presentation so that we can get a real or virtual microphone to you. A very warm welcome to our guest speaker, Mr. Brendan Seaton. I will introduce Brendan more fully in a moment. These seminars are hosted by the Waterloo Institute for Health Informatics Research, the Lawson Health Research Institute, and the National Institutes for Health Informatics. I'd like to acknowledge our seminar series sponsors, Borden Ladner Gervais, McKesson, and Healthcare Information Management and Communications Canada. We could not host these seminars without their support, and we're very grateful for their support. I have several brief announcements. Our next Smarter Health Seminar will be on Wednesday, March 25th, and details will be following shortly about this seminar. As well, we are offering 2 Health Informatics Boot Camps soon. From May 6th to 8th, there is a Health Informatics Boot Camp for Health Information Management Professionals at the University of Ontario Institute of Technology. This boot camp is designed exclusively for HIM professionals and is co-hosted by CHIMA and UOIT. Our regular Health Informatics Boot Camp will be held at the University of Waterloo from June 17th to the 19th, and we're also holding the eHealth Risk Workshops in Security, Privacy, and Risk Management from April 13th to 16th at the University of Waterloo. If you're interested, there's more information on our website, and registration is open for all of these educational programs. The Smarter Health Seminars this year is focused on health informatics and the e-health industry. The schedule for today is as follows. Brendan will speak for about 45, 50 minutes, somewhere in there, and then we'll have a facilitated discussion. We ask that you hold your questions to the end of this presentation, and please signal if you have a question and we will get a microphone to you. We invite the web and teleconference viewers to send in their questions by web chat. It is my pleasure to introduce Brendan Seaton. Last month, we learned about the state of the health informatics industry from Wayne Goodbranson, head of the Branham Group, and who better to follow that seminar but with our speaker today. I met Brendan some years ago now when he was VP of Privacy, Security, and Risk Management at the Ontario Smart Systems for Health Agency. We shared his interest in providing courses for people in privacy and security, and with his guidance, we were able to develop and we're now offering the eHealth Risk Workshops. Brendan is our instructor, and a very good one, I must admit. I've admired his teaching methods and how he engages the participants to learn and understand. I'm sure that we will learn a lot from Brendan today. If this were not enough to keep him busy, Brendan is the president of the Information Technology Association of Canada's Health Division, ITAC Health. ITAC Health represents more than 300 companies across Canada, almost half of which provide ICT products and services to the health sector. He is truly one of Canada's experts in health privacy and security. He's also a very talented photographer. I don't know where he gets time to do all of this. So who better to speak to us today on health informatics, tomorrow's industry, but Brendan Seaton. So please welcome Brendan Seaton.
Thank you very much, Shirley. Just let me get back to my slide here. I actually did change the name of today's presentation because I originally had Health Informatics, Tomorrow's Industry. Health informatics isn't really an industry, it's a discipline. So I've adapted it to the common term now that we're starting to use in this particular domain, which is e-health, which obviously is related to e-commerce, e-government. It's the electrification of the communications and the activities in the healthcare system. I've also focused this a little bit in terms of my point of view or the presentation I'm given. For those of you who are actually involved in the industry, much of what I say today you'll have heard before. What I really want to focus on, though, is to get a message to those of you who aren't engaged in the industry yet, those of you who are students, who are undergraduates, graduate students, and you're thinking of, where in this crazy economy might I go to engage in a very fulfilling and rewarding career. And I'd like to put the proposition to you that e-health might be where it is. So my pitch today is largely directed to you as an audience and not necessarily everybody else, but hopefully everybody who's on the line today will get some benefit from what I say. So first of all, ITAC Health. What is ITAC Health? As Shirley had mentioned, will this come up here? It's the health division of the Information Technology Association of Canada. Shirley had mentioned ITAC represents around 300 companies dealing in all sectors of the information communication technology industry. In ITAC Health, we're a division that looks after specifically those companies who are providing services into the health sector. And there's about 130 companies who are directly and actively engaged in providing these services. The Canadian ICT industry itself is rather formidable. There's about 520,000 jobs, 500,000 people working in the industry. It generates about $140 billion in revenue every year. $6 billion of that is invested in research and development. We have a fair export trade in our information and communication technologies, around a little over $30 billion, and $11.4 billion in capital expenditures. A lot of money being invested in information and communication technologies, a very large portion of that now, as I'll talk about in a few minutes, in the health sector. Now, what is e-health, this thing that we talk about? Well, certainly at the Waterloo Institute for Health Informatics Research, in our boot camps and in our risk management workshops, we define e-health basically in this way. E-health is the application of information and communication technologies and information management practices to the delivery and management of health services. Two big things there. There's the actual management of this great electronic infrastructure that's being put in place, but then there's the management of the actual data itself. What does it mean? How is it used? How do we make it effective in changing and improving the health status of Canadians? There's a number of very common applications that we consider when we think of e-health. Probably the best, the poster child, I guess, for e-health right now is telehealth. Telehealth is the use of communication technologies, particularly in remote parts of this country, to deliver health services in remote regions. A very common one, I mentioned, the next item on the list is diagnostic imaging or picture archiving and communication systems. What that is basically is what we once knew as radiology, with x-rays, for example, with a piece of film that a radiologist would look at. This can all now be done electronically. A little anecdote, I was, in September, I was doing some work for a number of First Nations communities, and I went up to a First Nations community called Sandy Lake. It's about an hour's flight in a little bush plane north of Kenora. And you land in this community on a concrete gravel runway. You sort of go through the what one would typically expect of a very remote northern community. You enter the nursing station, and the first thing you notice outside the nursing station, big satellite dish. And inside the nursing station, you walk into the telemedicine room, where you've got a telemedicine suite. It's kind of like walking onto the deck of the Starship Enterprise, almost. So what does this mean for the people there? An hour's flight in a bush plane to Kenora or Red Lake, another flight to Winnipeg or to Thunder Bay in order to get your care and treatment. This now can be delivered in the community by the nurses at the nursing station and actually a number of community members who have been trained as technicians to provide these services. Absolutely outstanding what you can do with e-health. Electronic health records, that's sort of the holy grail of e-health. Is, virtually every jurisdiction in Canada and many jurisdictions around the world are looking at bringing together all of the health information that's captured about us all throughout the health system into a single common view. Not necessarily one big database, but certainly a view that can access multiple data sources so that you could have your own electronic health records. Some of the more common applications that we have, hospital information systems, very well developed. This is probably the most mature part of the industry. Hospitals have been very much engaged in e-health probably for the last 3 or 4 decades. And clinical and practice management systems, and I'll talk about this a little bit more. These are the physician systems, which is really the new frontier in delivering e-health. Now, there's a lot of challenges in healthcare, and we like to think that e-health can help them. But healthcare itself is delivered in an extremely challenging environment. It's often applied to life and death situations. There's constantly evolving new and experimental procedures and products that are available to healthcare providers. It's a very highly stressful work environment for healthcare workers, and they deal with very complex situations. When you think of a nurse who's on a standard ward or floor, each individual patient has some incredible complexities associated with the treatment and care, but there might be 10, 20, 30, 100 people who have that. When you think of that kind of complex environment that the nurse or the team of nurses and other healthcare providers have to provide, it's incredibly challenging to keep track of all of this. So this is where e-health comes to the rescue, where e-health helps to expand the capabilities of the healthcare professional and worker by providing accurate and timely information to them when they need it, and providing expert system support, the system actually helping, prodding, guiding them in providing quality healthcare to individuals. We also have happening what I'd like to call the perfect storm happening with respect to the opportunities associated with e-health. A number of things are converging that never converged before. The very first one is that over the last decade, there have been tremendous advances in ICTs and information management techniques. When you think of the fact that 10 years ago we didn't have a BlackBerry, everybody thought it was a little piece of fruit. That was as far as it went. I started in health informatics early 80s when I actually was involved in a project where we were trying to use laptop computers to help community care nurses go out. Now, of course, at the time, a laptop computer wasn't like this. It was more like one of these things here. They used to call them luggables, not portables. At that time, the technology wasn't right for the kind of business environment that we're dealing with. Now that we've got portable devices, we've got wireless technology, we've got a wide range of communication and technology services that weren't available previously. They are starting now to catch up with the needs of people in the healthcare environment. So that's the first factor. The second factor is there's an increasing demand for health services in an environment of extreme or severe financial constraint. We're going to be lulled into a bit of a false sense of security, I think, over the next year or two, because we have our governments making massive expenditures to stimulate the economy because of the economic troubles that we're having right now. But at some point in time, those bills have got to get paid. So we're going to, even though we're going to see a massive infusion of capital into healthcare and into the economy in other ways, at some point in time, the debts will come due, and you're going to see a reemergence of significant constraint, and that's going to put severe pressure on the healthcare system. So ICTs are among the potential solutions for alleviating some of that economic and financial pressure. We're also dealing with a critical shortage of skilled healthcare providers. There's shortages of doctors, there's shortages of nurses, shortages of virtually every professional category or class of healthcare provider. And that's not something that can be changed very rapidly. You know, that is basically a function of the number of people coming into these professions out of the school. So if we know that there's a shortage today, it could be 6, 7, 8 years from now before that shortage actually starts to be alleviated if we start opening up new spaces in educational institutions for these things today. So we know that there's currently a shortage of services, particularly in remote and rural areas. You know, perhaps this is what information and communication technology can do for us. Our First Nations community in Sandy Lake can access, you know, they don't have a radiologist there, but they can access radiologists in Winnipeg and Thunder Bay and Ottawa and Toronto because of this particular facility that's available to them. So the technology is a possible solution to this limited availability of skilled healthcare resources. And finally, there is a need for business transformation in healthcare that you need technology to support. Right now, one of the big movements here in Ontario is to organize doctors into family health teams, which means doctors will coordinate with a group of other doctors in the same area. Now, part of that concept is, you know, it's a very exquisite concept, but part of that concept requires that they can share their medical records. So a doctor can, you know, who has a patient registered with him or her can make the information available to another doctor, you know, for those points in time when they might be, you know, off or on vacation or something like that. You need this electronic capability in order to enable that kind of reform. And again, those are things that are happening. So there's these various factors that are coming together to make government planners, to make healthcare professional colleges and associations wake up to the fact that, oh, maybe health or maybe information and communication technology can help us here. So what's the public's reaction to all of this? First of all, the public, and there's a lot, Canada Health Infoway has done an awful lot of you know, public polling and, you know, surveying of public opinions. And probably the biggest issue around public reaction is that they would be extremely surprised that we don't already have an EHR and supporting infrastructure in place. You know, I can go anywhere in the world and use my ATM card. You know, I can, you know, be, you know, on the other side of the world with a cell phone, being able to communicate with people back home. But if I'm, you know, I'm here in Waterloo, if I were to drop down with a heart attack and you were to take me into the hospital in Kitchener, they wouldn't be able to. They would have no idea, you know, who I was, where I was from, what my medical records or history were, and I just live in Toronto. So, you know, I've been in the business for a long time. I'm surprised that it doesn't exist yet. Certainly, the public would be very surprised. The other issue that we have to be sensitive to with the public's reaction is that there's lingering concerns about privacy. Now, for those of you who come along to our privacy workshop, we would talk about this an awful lot more. But I think the privacy issue is actually one of the success stories of dealing with issues associated with information communication technologies. It was recognized very early on that this was an issue. Most jurisdictions across the country now have implemented health privacy legislation. We have privacy commissioners to provide oversight. There's, by and large, the privacy issue has been solved, but there's this lingering concern that, you know, in the public's mind about it, and it has to be top of mind as we're developing our various health information systems. Now, some of the benefits that are purported for e-health, and they really form the basis of our business case when we're talking about e-health. First of all is improved efficiency, and that's kind of a no-brainer. Everywhere we've implemented technology in any sector, there's always been a significant increase in efficiency and productivity. And this is something that we really need to do, mentioning that earlier problem I mentioned about the current lack and the growing issue in terms of healthcare resources. We need to improve productivity and efficiency. Improve patient outcomes. This is actually a little bit of dodgy one. We intuitively expect that there's going to be improved patient outcomes, but currently there's not a lot of empirical data to prove that information technology actually makes an impact. We can expect, though, that we're going to start seeing this, and one of the things that we recommend in any of the major projects going on is that there be a strong evaluation component to make sure that we can track any improvements in patient health, patient outcomes as a result of the e-health intervention. Improve safety. There's some interesting or some very well accepted statistics that somewhere between, it's a big range, somewhere between 10 and 25,000 Canadians die every year because of preventable medical errors. A lot of those having to deal with drug interactions and other things that if you had the right technology in place you could potentially prevent. This is probably one of the biggest selling points for e-health is to improve the safety by improving the practice of healthcare in hospitals, in doctors' offices, community care centers, other places where healthcare is delivered. Patient empowerment, this is going to be a big one. This is actually the tsunami. We're now seeing entering this marketplace companies like Google and Microsoft with consumer health platforms. I'll talk about that a little bit more as well. Patients are going to, and all of us as individuals are going to have access to amazing technologies through our web browsers and be able to manage our own healthcare services and manage our own state of health. Again, we'll talk about that a little bit more later. Improved access, the telemedicine application that I described is probably the best example of that. Support to program reform, I've mentioned as well. Enhanced accountability. We've got we actually have hundreds of thousands of people working in tens of thousands of organizations across this country. Accountability is often a very big problem, but by the tracking capabilities of all of IT, of all of the different transactions that take place in healthcare, it's going to improve accountability and the ability to investigate whether it's malpractice or investigate quality of care, those kinds of issues. E-health is going to help us do that. Improve privacy and security, and as much as it's always been regarded as an issue, the technology itself actually improves by orders of magnitude the privacy and security of health records. And I think those of us who've been working in the field for a long time know that, but it's not really something that either the public or decision makers or other stakeholders have really taken in. But we really, there is a demonstrable improvement in privacy and security when we go electronic for our healthcare delivery. And improve access to quality data. The epidemiologists, the researchers, the people who are trying to constantly find new ways of protecting us, managing disease, developing new cures, they need access to data. And of course, capturing all of this stuff electronically creates a wealth of information that's going to be able to be used by the research community to develop new therapies, new products, new drugs, that sort of thing. Now, there's obviously privacy and security issues associated with that, but by paying close attention to all of these factors here, we can come up with e-health solutions that really deliver the goods on all of these benefits. Now, e-health investment. Those of you who have been following the news over the last 3 or 4 weeks might have picked up that e-health is actually now seen as a driver for economic development. And we've seen this in spades in the economic stimulus packages that have been implemented both in Canada and the United States. In Canada, the federal government has given Canada Health Infoway, which is the agency set up to fund and provide seed money, capital for e-health projects across the country to get up and running. You've got $500 million has been given to Canada Health Infoway to get on with the agenda of pushing electronic health records and other things. In the United States, in the Obama stimulus package, $19.2 billion put in to improve the state of electronic health records and other e-health applications. On the provincial level here in Ontario, They've just announced a new strategic plan for e-health in the province that includes investment over the next 3 years of $2.1 billion. So we see this massive infusion of capital in this particular year because of the need to stimulate the economy coming into the e-health space. Compare that to any other sector of the economy. Hardly any other sector is doing nearly as well. So certainly e-health is one of those areas that, like the environmental technologies, like any of the technologies driving energy efficiency, this is another one of those technologies that governments and other major investors are looking at as really the industries of the future. This is where we're going to put our money because this is where, as societies, we will generate the greatest benefit. Now, a little bit about the health ICT sector and what it looks like. As I mentioned, there's actually more than 400 companies. It's, the presentation given by Wayne Gabranson last month, I think he was around 450, 460 companies in that neighborhood there. Certainly a large number of companies who are providing ICT services in the health sectors. Unfortunately, they're all not members of ITAC Health, but this is our business opportunity to try going after them for membership. They provide a wide range of products and services, so we're not talking about one thing when we talk about e-health. There's different kinds of companies. There's infrastructure providers, the telcos, for example, Rogers, TELUS, Bell, people who provide the network infrastructure, the backbones, the fiber optic cables, the satellite linkages. Those companies are all part of the e-health world, and an integral part because they actually provide the communications channels that link all of these systems together. There's hardware and software platform vendors, so companies like Microsoft, Hewlett-Packard, RIM, the companies that provide the hardware and software infrastructure that's needed. Consumer platforms, I mentioned Microsoft. Microsoft and Google are both getting into this particular space, and they're going to be using their massive infrastructures to leverage e-health and healthcare. Health software and devices, companies that actually develop applications that are unique to the healthcare, so the hospital information systems, the physician clinical management systems, EMRs, EHRs. Systems integrators. The big challenge is going to be pulling all of these things together. You can sort of see that there's a lot of pieces here. We need those companies, those companies who specialize in integrating all these technologies. They're going to do very well, as well as the consulting firms, often who play in the system integrator space themselves, but also do a lot of work such as strategic planning and information system architectures and those kinds of things. They tend to be heavily based in Ontario and Quebec, and this is actually a little bit of concern, I think, when you think nationally, especially where a lot of the investment is happening in Ontario and Quebec. There's going to be demand for resources in other parts of the country, and when we start getting into this competition, and I'll talk about that much more, you can imagine some of the stresses that are going to occur. So some of the industry strengths, I'm going to just do a little bit of a SWOT analysis here, strengths, weaknesses, opportunities, threats, to give you a little bit of sense of the state of the industry. So in terms of the industry strengths, we are by and large, even though there's a number of unique software and application products in healthcare, we are marketing products and services that have been proven in other sectors. And we have a lot of experience in other sectors like finance, like retail, like manufacturing. Now, healthcare is different, and we need to recognize that. But we're not going in with brand new, out-of-the-box, cutting or bleeding-edge technologies here. We are implementing, by and large, very strong, stable, and proven technologies. We've got this emerging market for electronic health record and consumer health solutions. With the exception of Alberta, there probably isn't a provincial electronic health record anywhere else. Alberta has somewhat of a rudimentary one, but a pretty solid product there, but they're pretty much alone. This is a green field. And every jurisdiction is wanting to do that. The consumer health solutions, the stuff that Google and Microsoft are working on in terms of platforms, when you think of the number of applications that will be leveraged off of that, it's rather extraordinary. Significant investment by governments who see healthcare or health information communication technology as a CSF or a critical success factor for health system reform. Governments are recognizing that they cannot change the health system without the investment in this technology. And as I mentioned earlier, governments are recognizing that health ICT is a 21st century industry with very strong export potential. So, these are all key, strengths as the industry goes forward, and bodes very well. But there are some weaknesses and challenges that we have to face here. And when we talk opportunities and threats and weaknesses and whatever, there's often two sides to each. They're all two-edged swords. Because even though I said there's this tremendous opportunity for integration in companies who are involved there, this is an extraordinarily complex environment. When you think of the integration of information communication technologies with all of the biomedical devices that are out there, be they the CT scanners, the MRIs, the big things in the hospitals, but also the small things, prosthetic devices and pacemakers and implants and things like that. There's an extraordinary complexity, and the challenges of integrating those things are formidable. So all of you guys who are engineers, guys and gals who are engineers and information technologists and that, there's extraordinary amount of stuff here. There's also a very complex business environment. You've got multiple jurisdictions. In Canada we have 10 provinces, 3 territories, and a federal government, all of whom are involved. Within each of those jurisdictions, there's sub-jurisdictions. Here in Ontario, we've got the local health and integration networks, so sort of regional groups that exist. From a business point of view, extreme complexity. All kinds of people are involved in this particular space. Technical and application standards are in an early stage of development. There's been some tremendous progress over the last 5 to 10 years in the development of standards, both for technology but also for data. That's probably the bigger challenge for healthcare, so that a code in one system is recognized, has the same meaning as the code in another system, getting those things to communicate. So even though there's been significant progress, we're near finished the job of standardization. Low penetration of ICT into the primary care and community care environments. Great opportunity here, we can think of it at that, but the fact that a very small percentage of doctors right now, the numbers vary between 20 and 30%, have clinical management systems. So that means there's 70% out there who are still working on paper. My doctor works off, my medical record right now, it's 3 foolscap pages and a few pages with lab test results in a manila folder. That's my record. I saw it 3 weeks ago. And actually I tried to read it, and there's no encryption algorithm that beats a doctor's handwriting. That's for sure. I didn't have any clue what it said, although the doctor was, he was able to go through. It made perfect sense to him. But this low penetration is a bit of a boat anchor for us, because this is where it's in the doctor's office that that most of healthcare actually happens. And a lot of initiatives are driven top-down, led by government investors rather than bottom-up for healthcare providers. There's been a number of spectacular failures in the e-health space over the last few years, largely because they were driven, as I said, sort of top-down from people who paid for healthcare, and not just governments. Insurance companies and that were also, I think, culpable in this, is that the systems were being developed to save them money rather than starting at the bottom saying, well, we want to provide better care for people. And that's starting to change now very dramatically, but that's been one of the significant weaknesses in the sector. Talking a little bit about the integration challenge. I stole this slide from a Canada Health Infoway presentation, and it's a little bit dated. This number is probably bigger right now. But Canada has approximately 40,000 health information systems that need to be integrated. It's probably more like 50,000. Now, if I was using a more up-to-date slide. Add to that the fact I said we've got very low penetration, say, in the doctor's office and community care. In Canada, there are 65,000 doctors, okay, and a number of those will share systems, but that means there's a lot more to be brought together. So you've got this incredible complexity, as I said. Now, sort of reminded me of that quote from John Glenn before he went up in the Mercury capsule. He said, "How would you feel sitting on top of 2 million parts that were built by the low bidder on a government contract?" That's somewhat the kind of situation that we're in. This is, again, from Canada Health Infoway. This is their conceptual architecture. When you see all of the different parts here, and if we just go down here and look at the physician providers, there's 65,000 of these guys out there. And they just make up one very small part of this system. So this is the complexity that we're dealing with, but it's also the opportunity. Now, opportunities. I mentioned about consumer health platforms. This picture you see right here is a screenshot of my daughter's Facebook page. I put it up here. I didn't ask her consent or whatever because I figure she put it on Facebook. She's disclosing it to the world. That happens to be my grandchild who will be born in May. Consumer attitudes are changing very dramatically when it comes to health information and the use of internet-based technologies. This is very clearly as I said, the tsunami in terms of applications, and very exciting application, because this is something that we can all use. Everybody who's got an internet connection now, everybody who's got a phone or a portable device has got access to this kind of facility. Electronic health records, as I mentioned, still a green field. This integration opportunity, the reform of the healthcare system that must take place. Chronic disease management, probably the most brilliant thing that I've seen in this particular field in the last 5 years is the new Ontario eHealth strategy. They have completely turned about, and I mentioned this idea of a top-down versus bottom-up, is that they, 10 years ago or 5 years ago even, and when I was working at Smart Systems, it was this way. It was build these great big, build it and they will come kind of attitude and approach. And a lot of it was driven at trying to make things easier for bureaucrats and cheaper for those who are paying for health care. Now focusing on chronic disease management, in Ontario they're focusing on three things. They're focusing on diabetes, they're focusing on reducing the wait time in emergency rooms, and they're focusing on medication problems with drug interactions and things like that. I think you're going to see a tremendous change in attitude and approach to the development of these things, because we're actually solving real business problems for doctors and nurses and patients and people who are actually receiving health care, rather than the macro problems that exist in the mind of bureaucrats. Patient safety also is one of those big things that we really have an opportunity to put a dent in those 10 to 25,000 deaths and obviously many more other injuries that are caused by medical error. Some of the threats that we're facing, and this is where some of you come in, the biggest one that we're facing right now is the lack of skilled human resources with expertise in health and ICT. Without question, this is where this is the big issue that we're facing right now. All of our member companies are telling us that, as well as we know on the provider side. Hospitals, health regions, provinces are having a hard time getting the people they need to manage and run all of these projects. Adoption by healthcare providers. This issue that I talked about, in terms of the low penetration in the primary care environment. Getting the healthcare providers bought in is a big challenge. And competition for resources with other sectors and countries. Obama is investing almost $20 billion in health ICT. We want to try and keep you guys here in Canada working on Canadian projects. This competition with other countries and also with other sectors. Eventually the finance sector and the manufacturing sectors, they're going to start ramping up and gearing up again, and we'll be in competition with those. So what's industry's response to this, and what are the kinds of things that ITAC Health is promoting? 5 things: advocacy, capacity building, work around physicians' office systems, interoperability and standards, and a new thing we're starting to get into right now is looking at more opportunities for export and international trade. So advocacy, what are the messages that we're trying to put out to the big decision makers who deal with healthcare? First of all, the first big message is let's finish the job. According to Canada Health Infoway, over the next 10 years, we're going to need somewhere between $10 billion and $12 billion in capital investment. We've seen some of that, some of the numbers. Ontario is spending $2 billion. The federal government's just announced another, $500 million, but that's still a distance away from what it's actually going to take to get this job done properly. In addition to that, $1.5 billion to $1.7 billion in annual operating costs. After we've built these systems, somebody's actually got to run them. And we're going to see a significant investment in the skills that are needed to manage and maintain and constantly renew and upgrade these systems that are being put into place. The second thing that we're looking for is a single Canadian marketplace. From a business point of view, it's a real challenge having to deal with 14 different jurisdictions, each of whom have similar but not the same rules. So it often means that there's a vendor of a software product in one province has got to make potentially some very significant modifications to that product to sell it in the next province, even though healthcare is basically the same in terms of how it's managed and how it's administered across the country. So we're looking for national standards, and we're also looking for some consistency in performance practices, in terms of the standards that are put into tenders, requests for proposals, and things like that. So that idea of a single Canadian marketplace is important. And something that ITAC promotes very strongly is the whole notion of smart regulation. We've seen in the United States financial system what happens when you let regulation go. Okay, and that sort of went to the extreme. Now, the opposite extreme of too much and excessive regulation also isn't good either. So we've sort of coined the term smart regulation. And in the e-health space, that will largely focus on issues of safety. So the kinds of things that Health Canada does with respect to medical devices or drugs or food products, one might expect that over time we're going to see similar kinds of regulatory controls. And we're supportive of that, but we just have to make sure that they're done in such a way that accomplish the objective of maintaining safety, or whatever other issue is at stake, and making sure that it's effective and efficient and isn't going to cause excessive delays for products and services and to get on into the market. So that's our advocacy program. Capacity building. Okay, this is where we need to start talking very intensely with you and with universities and other post-secondary education or post-secondary institutions and that, because we've got to build the human resource capacity to meet the needs. Two dimensions of this. One is we're looking at the supply side of things. So we're looking at things like how do we increase enrollment in post-secondary programs that support health ICT. Immigration policy and recruitment from overseas. How do we how do we make it easier to recruit from overseas? Crossovers from other sectors. How do we encourage people from finance, retail, even other people in the healthcare sectors who might be doctors and nurses? How do we get them involved? How do we get them to cross over and become health ICT professionals? And something that's going to happen more and more is, the whole notion of offshoring. Is that right now, we see that most of the programming work done by Canadian organizations, or certainly a great deal of it, is happening in countries like India and others that have highly educated workforces, but can provide a more competitive price for to deliver. So there's certain things that we're never going to be able to get enough people to meet the demand here, so we need to look at those kinds of options as well. So that's on the supply side. Then we have to start looking at productivity. How do we actually increase the productivity of people who are working in the field? That's the other way of dealing with the capacity issue. And we're looking at various certification programs. There's a new certification program that Coach, the Health Informatics Association, has come out with to certify health information technology, or health information professionals. Continuing education, like the program that we have here at Waterloo with the boot camps or whatever, that kind of programming needs to continue, as well as improved methods and methodologies for developing and deploying and getting to, getting into the system, these various systems. Who are we looking for? Different kinds of folks here. Health research and development informaticians, and these are people who will largely be working in the academic community or in research institutes and that. These are the people who try and make sense of this great store of health information that we're going to be that we're going to have available to us. So that's one dimension of it. We also have what we call applied health informaticians, or when we're sort of struggling with what, the terminology, what to call these different groups. But these would be people like health information managers, those people who today work in the medical records or health records departments of a hospital, helping healthcare professionals to get access to the information they need to treat patients, as well as health information technologists, people who actually build, run, deploy the systems, the technology systems that we put in place. And another class of folks is what we would refer to as the e-health enabled clinicians. And from an industry point of view, this would be people like the super users, like the early adopters, those who take a leadership role in, whether it's in the doctor's office or the hospital or other healthcare center, the actual clinicians themselves who take, embrace, and help promote the technology. So how many and what will they do? You're just using some back of the envelope calculations right now. And we've got some survey work that we're doing with Coach and Canada Health Infoway and CHIMA, the Canadian Health Information Management Association, to get real numbers here. But we'd probably be looking at somewhere in the neighborhood of 50 to 20,000 new health ICT jobs are going to be created over the next 3 to 5 years. A lot of people. The integration, deployment, and operation of e-health systems, that's going to be the lion's share. That's a very big thing. There will be some development of innovative hardware and software solutions, not so big, but still potentially important. This would be almost the R&D side of the business. And the industry itself, companies who are involved in this space, what kind of people we'll be looking for? We'll be looking for project managers, we'll be looking for business analysts, change management specialists, people engaged in operations, all manners of technical specialists, be they network security specialists, all of the people who are going to be needed to actually build and operate these systems for us. Just a few comments around physician office systems and electronic medical records. This is really the alpha and the omega of the electronic health records. I showed you that big complicated slide that Canada Health Infoway had for this whole infrastructure where we're going to have great data repositories and networks and whatever. The key thing is that it's at where the doctor or the nurse or other healthcare professional is providing care. That's the beginning and the end. This is where information is entered into all of these systems, and this is where it's got to be retrieved so that doctors and nurses can make good decisions about the healthcare they're going to give you. So this is really, as I said, truly the new frontier, or the coal face, if you will, of the whole e-health infrastructure. We're going to have to do a lot of work, and this is a lot of the stuff that we're doing at ITAC Health, is coming up with strategies to promote the adoption of technology by physicians and other primary care providers. And a lot of that has to come up with a good value proposition. To a large extent, we haven't had a great value proposition for doctors. It's like, you computerize and the Ontario Ministry of Health will save millions of dollars. Not a compelling argument to somebody who's working 12, 14-hour days and is feeling a little bit hard done by. But you go in with a value proposition to say that, okay, this can improve the efficiency, or we can set you up now in a family health team where you can take an evening off, where you can take a vacation, and your patients are still going to be cared for. All of a sudden, but oh, by the way, you need some technology to help you do that. All of a sudden, you've got a value proposition, something that makes their life and quality of life better. So we've got to get much better at coming up with value propositions for for the people we want to use these systems, and through various incentives as well. A lot of challenges around interoperability with the health infrastructure. Okay, so we said we got 65,000 people to connect with a very, very complex infrastructure. That's a big one. And the alignment of provincial and national procurement strategies. Right now, this is a whole other discussion. The procurement strategies right now in this particular space are all over the map, and it's very challenging for companies to sell into the marketplace because you have a lot of intervention by government in terms of bonuses and incentives and that for to get doctors to buy particular systems and whatever. So that's something that we need to focus on. And something that's starting to happen right now is to start looking at conformance testing, is that coming up with some kind of this idea of pushing a national marketplace, come up with some sort of a national conformance testing strategy. So a system that works in New Brunswick will work in Ontario, will work in Saskatchewan, will work in British Columbia. Interoperability and standards, this is a very active area for us. We actually coordinate all of the industry input into the technical, into the various standards that are being put forward for health ICT and health information. There's Canada Health Infoway operates something called the Standards Collaborative, which is all the different standards groups, health standards groups across the country to try and coordinate things. We are involved in a number of provincial standards organizations. And there's something that we actually do every year there's a big e-health conference once a year. This year it's coming up at the end of May in Quebec City, where we have what's called an interoperability showcase, where we actually try and demonstrate that all of these different systems, lab systems and hospital systems and doctor systems, whatever, can all communicate and interact with one another. And we're looking at Canada Health Infoway is just coming up with a certification program, and we're working with them to figure out how do you best go about setting up a certification program for health ICT products. And there'll be a lot of activity and work in these areas here. Something new that we're starting to look at, we did some strategic planning back in November at ITAC Health, and one of the things that came out was looking at more this whole business of the export and international trade. We're in a global marketplace when we're talking about health ICT, without question. When you see the investment that's being put into all of the different systems in all the different countries, it's very clearly a global marketplace. The Canadian marketplace itself is too small to sustain a robust and internationally competitive industry. Anybody who really wants to survive as a business has got to look at exporting their products as well, because the Canadian marketplace just isn't big enough to do that for them. We're also starting to grapple with now the globalization of healthcare, the fact that when you see the possibilities for telemedicine, my friends in Sandy Lake, they're right now communicating with Winnipeg and Thunder Bay. They could just as easily communicate with Boston, with London, with Paris, with Beijing. So the potential for the globalization of healthcare, spurred in part because of ICT, is a big possibility. And it's very competitive, extremely competitive environment that we're in internationally. So I'm going to close off a little bit, and again, just talking to those of you who might be interested in getting involved in the health ICT business. I'll just reflect a little bit about why I'm in this business. I joined this business officially in April 1980, so that's coming up to 29 years actually, in just a month or so. So why am I in this business? Well, first of all, there's a bunch of really cool people who ride motorcycles. And actually, I'm just going to diverge for a moment here because I thought, okay, by the time you get to this part in the presentation, everybody's like, So I'll just tell you a little bit of story here. And I'm going to take the opportunity to do some Toronto bashing, because you'll notice there, I don't have a laser pointer, but I'm sitting under a sign which is at the end of Highway 11, which is in Rainy River, Ontario, which is on the border with Minnesota, just a few miles from the Manitoba border. And this is where people in Toronto think Yonge Street ends. As a matter of fact, if you go down to the foot of Yonge Street in Toronto on Queen's Quay, you will see embedded in the concrete in nice brass letters, Yonge Street, the longest street in the world, and they will have different points, in terms of the mileage. So they'll have, North Bay and Kirkland Lake and Kapuskasing and Thunder Bay, and they'll have the distance. At Rainy River, it's about 1,800 kilometers. North of Barrie, nobody calls it Yonge Street. It's a great lie. I call it the longest lie in the world, and here's my evidence. In Rainy River, when you get to Rainy River, in front of the City Hall, there's actually a little sign out there that says Yonge Street that they put up for all the Toronto tourists who want to have their picture taken by Yonge Street. But you will see here, the actual name of the street in Rainy River is Atwood Avenue. So again, another part of the lie. Now, I'm from Toronto. I'm in recovery. What more can I say? But let me just, as I said, close on some of my reasons for being involved in this industry. And the motorcycle is actually a big part of it. The ITAC Health, or the ITAC group in Mississauga, every year we get together and we go to Friday the 13th in Port Dover. A real blast of a time. First of all, it's a noble purpose. This is an industry that you can get into and actually feel good about what you're doing. Sick and injured people get well because of the work that we do. It isn't like working for the tobacco industry or working for the automotive industry, or other industries which actually have the potential to kill people. This is something where the whole purpose of it is to do great things for individuals, and it involves all of us. It's our friends and family and children and parents, and all the people that we care for are touched by what we do. And I think that's probably the most compelling thing. When I was in Smart Systems, I would have people, I used to hire a lot of security specialists who came from the banks, and I would often ask, well, why are you coming here? Because I'm actually offering you less money than I know you're getting now. And a lot of the reason was, it's such, I'm seeking a little bit of meaning in what I'm doing. So that, I think, is probably without question the most compelling reason. It's also very challenging. I've been through a number of the real, interesting problems that are before us to solve, and it's actually a lot of fun. There's a lot of really interesting people who you have to engage with to solve these problems. And now we have, governments and other organizations who are actually prepared to invest money to help solve these problems. It's a growing sector. It's in an economy where you're seeing virtually every other sector shrink. There's more money, there's growth happening here, which we're not seeing in virtually every other sector of the economy. There's a lot of really nice people. Now, I guess you get really nice people in most sectors, but I have found that in all of the organizations that I've been involved with, there's just partly because of some of the other reasons, the noble purpose and the challenging environment, you really do get a very, strong camaraderie and strong and very positive interaction with folks. There's a career path. Now, it might not always be in the same organization, but as an industry, there's a place, you can move through this and you can progress and do very well. And money ain't bad. It's not the highest paying industry, but it's extremely competitive. And when you start getting into the industrial sector, and just to explain why, part of the reason why, certainly in Canada, you don't have quite the same salaries is that whether you're in industry or in the health sector, it's a publicly funded thing. Okay, and there's a lot of constraints on publicly funded activity. So that's why there tends to be a slight depression, but all of the other factors very clearly makes up for it. And for all of those who were in other sectors that used to be highly paid, they're all looking for work now. So there's a lot of, as I said, an awful lot of benefits to being a part of the health ICT industry. That's my contact information for anybody who wants to call me. I would be more than happy to talk to and communicate with anyone. And if you happen to work for a company that's not a member of ITAC Health right now, definitely call me.
All right. Well, thank you very much. That was very interesting, Brendan. Normally at this time, our sidekick, Dominic Covey, would be facilitating this discussion. He happens to be away today, so you're going to have to make do with me. Dominic covered for me last weekend when I couldn't do a presentation at a conference. He told me that he put on a dress, dyed his hair blonde, and proceeded to do my presentation. I did not agree to do the similar thing today.
And we thank you.
So I am not the Dominic lookalike. But I would welcome questions from the audience and from our web viewers and video conference attendees. So are there any comments?
Brendan.
Yes.
Brendan, I'm Rick Roach with the Co-op Education Department at the University of Waterloo. I find it interesting the fact that there's such a huge shortage in this field, and yet here at the University of Waterloo we just have such a huge co-op program. And working in the department, I see sort of what I would call a token participation with companies in this area working with our co-op program. And if they're looking overseas for people, they're looking at hiring 15 to 20,000 people next 3 to 5 years. What am I missing here? Should we have more people participating with, mentoring, getting people into this field, or are we not doing something right to get out to these companies?
Well, I guess at different universities and different places.
Could you repeat the question? That might
Okay. Well, the question, basically, if I can just paraphrase it, was here at the University of Waterloo, where you do have a very aggressive and active co-op program, it's not so much in this sector. And what is it that I guess what is it that you should do? I know a number of universities do engage a number of our companies as well as other organizations involved in health informatics in a very big way. Actually, Waterloo does. I remember at Smart Systems we had a number of Waterloo co-op students who were involved there. I think there's two things. One is the programs are there. It's probably only in the last 2 to 3 years we've started to see this crunch in terms of resources. So I think what you're at is when we're at the precipice, and there's an opportunity now for Waterloo and other universities as well to take good advantage of the fact that companies are going to be needing these resources. It's in a company's or a health organization's interest to engage, get to know a number of or co-op students, because they're very solid future employees for them. So I think there's great opportunities. I wouldn't feel too badly about the amount of involvement in the past, which I think has been significant, but it's just an opportunity to have an even more significant involvement as we go forward in the future.
Would there be some opportunity for Waterloo to meet with the ITAC members, ITAC Health members?
Well, to some extent, you do. You do have your. I know your open house programs and that for Waterloo students, who a number of companies come to, most of whom will be ITAC Health members. Certainly, we can promote more. Amongst the ITAC Health members, the opportunities when you're having your job fairs and that sort of thing, just to make them aware as well as students aware of the opportunities.
All right. I understand that there's a question from the web.
Who is driving the vision for a national strategy and a provincial strategy? And I just got another one. So after you're done this one, I have another one for you.
Oh, okay. The national strategy very clearly being driven by Canada Health InfoA, or led by Canada Health InfoA. And Canada Health InfoA has been very good about creating a very collaborative kind of environment, whether it's dealing with standards or dealing with their strategies and approach to investing money. So on a national basis, it's there. On a provincial basis, here in Ontario, it's the new eHealth Ontario agency that has the lead for it. They've just come up with I think one of the best eHealth strategies I've ever seen. in terms of this province here. Other provinces across the country, it's typically the the Ministry or Department of Health that takes the lead, and I know virtually every jurisdiction across the country, actually probably every jurisdiction, I can say that with some confidence, is developing driving strategies. So it would be the Canada Health Infoway or the various ministries, departments of health.
Just a question about that. Is there some formal provincial Canada Health Infoway liaison?
The Board of Directors of Canada Health Infoway is made up of the Deputy Ministers of Health for every province and territory across the country, so very definitely. Yes. They actually form the governance. Canada Health Infoway is actually, even though they're funded by the federal government, its governance is essentially the provincial health jurisdictions.
Are there any specific certification courses or seminars that HIM professional in Newfoundland could avail of?
Oh, that I'm not absolutely, well, I would say certainly through CHIMA, the Canadian Health Information Management Association, they would be, they would have the lead and responsibility for, for both certifying any programs as well as promoting the development and delivery of those programs. So I would direct that question very specifically to CHIMA, who really, as an organization, is in this particular field, has the most experience in dealing with issues of education and certification of members or of its members with respect to health information management.
Another question. Hello, Brendan. I'm an MBA student at Ivey School of Business at University of Western Ontario. I'll be finishing this August 2009. Where do you see opportunity for somebody who has technical skills and management skills?
I would say the best bets, if I would, any of the companies, when you're dealing with technical and management skills, those are very marketable skills. So companies that are going after any of these major e-health initiatives, as well, I think there's, it's a pretty open field for dealing with any of the health regions. Any of the, for example, here in Ontario, the local health integration networks, they all have e-health, chief information officers and e-health leads who are always looking for people with those kind of skill sets. And I would say that's probably fairly common, right across the country. I think the simple answer is everybody would want your skills.
I have a question for you, and I guess it goes back to your comment that the ICT holds so much promise to Canadians, in that the promise to Canadians is that everyone will have equal access to health care. But I also see in the newspaper on a regular basis where emergency departments are closing down in some of the smaller hospitals, or there's the threat of them closing down. And I see what I think is a growing disparity between rural and say the more distant areas in Canada from the urban centres and their service. Is there anything in the Canada Health Infoway strategy or the provincial strategies to ensure that this doesn't become a two-tier, and by that I mean rural versus urban healthcare delivery?
Well, I think there's just some simple realities, and being I guess sympathetic to the ministries of health that are trying to deal with this. The problem of using the traditional model that we had previously, which was we physically encountered our healthcare provider. With a shortage of healthcare providers and the tendency of doctors and others to gravitate to urban centers, that's left the gap out in the rural communities, and I know that's been a real challenge for ministries and departments of health across the country. They've done all kinds of things in terms of trying to provide incentives to get people to go to those communities, but it just doesn't happen. very clearly as well when you get into some of the specialties, and actually this is where ICT starts to help, where you get a specialty like radiology, for example, where it's very difficult for, to justify, you couldn't justify having a radiologist go to Sandy Lake, but but the radiologist in Thunder Bay who's reading those digital image scans, and providing advice back to the nursing station in Sandy Lake, that's a very effective way of delivery. So I think there's the systemic problem of a shortage of healthcare providers. We can mitigate that to some extent through ICT, but we'll never completely replace it. But this is certainly one of the areas that we can provide some assistance. The discrepancy that you're seeing there, I don't think there's any deliberate or policy reason for it. It just happens to be the reality of the demographics of a country that is becoming increasingly urban at the expense of those who are still a part of the rural economy.
Thanks for your presentation. You mentioned some major challenges to adoption in primary care, and on the other hand, good adoption in hospitals. For 30 years now, there's been some much better adoption in hospitals. Where does long-term care and home care stand with respect to ICT?
They're probably in the same state as the primary care. And again, a lot of that has to do with, and this is why the linkage to healthcare reform is so important, because for the last 50 years, most of our investment in healthcare has gone into hospitals. And hospitals, as a result, have had the resources to invest in health information technologies. In community care, it's a fairly recent phenomenon that's becoming a more important sector with respect to healthcare delivery, especially as we have all these baby boomers, like some of us in the room here, are getting old and gray and foolish. That's we've got a direct path to these particular places. So at this particular point in time, I would say long-term care, community care is again at those initial stages. Now we see, certainly here in Ontario, actually in a number of other provinces as well, we see some very significant advances happening very rapidly. The community care access centres here in Toronto or in Ontario, for example, are becoming very well equipped with information technologies. And part of this as well is, mentioning at the very, one of the factors was some of the advances in ICT, and I use my example of this computer that we tried getting a nurse in 1980 to use, but she would have been off on disability if she tried to carry it around, kind of thing. The technology for that sector, that's a sector where the technology now is just becoming portable enough. Even when you think of a nurse going in, now they can use wireless. At one point, if they wanted to connect to the office, they'd have to go and find a 2400 baud modem to try and hook up, and and that was assuming that the client had a telephone jack to go into. We're now in a situation where the forces are converging so that we can do more for the community care sector, as well as the fact that more money obviously is getting invested in that sector, and they're going to be better equipped to make these investments.
As far as the kind of newfound interest in chronic disease management and software and kind of hardware devices, are there companies, perhaps members of ITAC Health, who are working to develop software for chronic disease management that would maybe end up in long-term care or home care?
The only answer I can give you is probably. It is an area. Well, let me put it this way. I don't think it's necessarily a company in ITAC Health who happens to have an off-the-shelf product that's going to be able to be used in this sector here. What we're more likely to see is an organization like eHealth Ontario making an investment and get award a contract to some group of companies to develop those kinds of software products so that they can manage these diseases more effectively in whatever environment is necessary. It's not just a a question of a company thinking, there's a product opportunity here, I will run out and build it. We'll be taking the lead to a large extent from Infoway, eHealth Ontario, those organizations who are making decisions about where they're going to invest the money and where they're going to put the priorities.
We have in the audience somebody that maybe can answer that question a little bit as well. Joe, do you want to make a comment about that?
Thank you. The good news is that there is a local company here in Waterloo, well now based in Kitchener, called MedManager, and we've actually developed about 8 years ago an online chronic disease management program, and it's been through a clinical trial. We have our Class 2 medical device license, and we're deployed at a retirement community here in Waterloo, and we've had great uptake from the residents, average age 83, using the system in conjunction with the healthcare providers that are there. So not only is there technology out there already, but people are using it, and it's making a difference in their quality of life and health outcomes.
Excellent example. Thank you for sharing that.
I have another question, and that is, seeing that our friends to the south are embarking on a heavy investment in e-health or health infrastructure, and we already have a shortage of people, how do you think we're going to retain the people that we have when there could be such a strong draw to go to the south?
I think we promote what's always been the advantage of Canada, say, over the United States, and we're promoting quality of life issues. We're promoting, not necessarily salaries, but they would certainly have to be competitive. Having a strong, robust healthcare system is, we know the travesties that have existed in the United States as a result of their particular system. There's a lot of benefits, advantages of living and working in Canada, but certainly we can't be complacent. We've got to recognize that some people are going to be drawn to the bigger dollars and better climates that some parts of the United States have to offer. But obviously, we have an awful lot to offer here too, and that's part of our also our investment is important because we need to have those interesting jobs and give people the opportunity to tackle those interesting challenges, because that's certainly why myself and many of my colleagues have stayed where we are, is that the environment that we're in, it's a heck of a lot of fun. Now, you can ride motorcycle year-round in the southern states, so that's always been a big issue for me.
From the web.
Continuation from our MBA student. Brandon, great presentation about e-health. Where should we go to find information next? I find that there are a lot of resources with regards to e-health. Any blogs or portals that offer relevant and timely news and research?
The two that I would recommend if you're in Ontario is, certainly the Canada Health Infoway site, and they have a section. They have a very strong resource section, and they've got a what they call their, I think it's Knowledge Way or something like that, they have on their site. So there's a lot of very good information there. There's good information on, and it's starting to build, but some of the stuff on the Ontario. eHealth Ontario, the new eHealth Ontario agency's website. You can certainly go there and get their new strategic plan, which, as I said, is probably one of the best articulations of the needs and an approach to eHealth that we have. And then I guess it's just getting, it's why God created Google, I guess, to some extent, is that there is a wealth of information around, and because when we talk about e-health, as I said, it isn't one thing, it's a great many things. And if you're interested in community care, if you're interested in acute care, if you're interested in building large network infrastructures that are highly secure, there's there's unique resources for all of those things. I think certainly probably the best, if you have an opportunity, if you haven't been a part of the Health Informatics Boot Camp, I think that's probably the most comprehensive, both library of lectures and information, as well as sort of a very interesting interactive, experience when it comes to going to the boot camp. I would say that that's from an educational point of view, is a good place to look.
I guess I have a question, and that is that a tendency, and I know I do this myself, is to focus on the technology. It's cool, how it's going to develop and all that sort of stuff. But what's really critical in my mind in all of this is the change management that's going to have to occur, and the resources that will have to go into making that part happen. So is the investment that you see coming from Canada Health Infoway and the provinces, is it devoted more to the technology, or are there equal or more sufficient dollars, whatever dollars that may be, for that aspect, the change management?
Well, I think that probably the greatest contribution, or one of the great contributions that Canada Health Infoway made to this whole domain, was the recognition of what you said there. Is that so many, and I've been, sadly a part of a number of them. There, so many systems were pushed out because you might have had a champion and a few technology whizzes in an organization who tried to literally impose a technology on the rest of the organization. The whole thing fell flat. Canada Health Infoway, as a part of its funding model, as well as a number of the provincial governments, again, probably all. I'm just reluctant to say all, because I don't know what PEI does really, but most jurisdictions do invest very heavily in that change management part, and they recognize that that is as important, and actually probably the bigger part of the investment. The technology in many circumstances is quite trivial. It's the impact on all the business flows, on the organizational culture, the changes in roles and job functions and responsibilities. That's where that's where projects fail. It's not in the technology ultimately. If unless it's highly experimental, is going to work when you plug it in. The question is, will people actually use it on a day-to-day basis, and will they embrace it, and will they themselves start to advance its use?
Any other questions from the web, or any other questions from the audience? Well, I have really enjoyed this presentation, and it's always my pleasure to be able to thank the speaker. So, Brendan, please accept this gift as a small token of our appreciation. We thank the audience that came today, both in person and virtually, and we welcome you back to our next seminar on March the 25th, and have a great rest of the day. So thanks everyone.